Hello, welcome to my channel. My name is Nebly. I'm a licensed massage therapist and esthetician, and I'm here to talk a little bit about carpal tunnel syndrome. So we're just gonna go into the basics. I'm not gonna get into the nitty-gritty. If you need that, you should read a few textbooks. There's some really good ones out there. I'll actually link the one that I got my majority of my information from, but I did get my information from 3 different sources. But I'm here to tell you just a little bit about carpal tunnel syndrome, what helps to prevent some of those symptoms. Well, we'll talk about some of those signs and symptoms. We'll also do a test, a few tests to see if you could possibly have carpal tunnel syndrome. Nothing's definitive. You need a medical professional for that or a physical therapist. And then what you can do as far as stretches. So we'll do that towards the end. Stay tuned. So first things we're gonna do is actually look for the carpal bones. There's 8 of them, and they're situated sort of in the heel of the hand here. And there's 2 styloid processes, two bumps right here on before you get to the carpal bones. So you're not hitting those, and a way to find it is kind of twist or tilt your hand to the side that way, and you know that there's a bit of a gap there, so that's not it. It's more along the heel of the hand here. So that's where your carpals are. There's 2 structures that form the carpal tunnel. So everyone has carpal tunnels, 1 in each hand. So that's kind of why saying you have carpal tunnel and referring to the syndrome is kind of funny to some massage therapists and professionals, because we all have carpal tunnels, 1 in each wrist. So it's composed of 2 structures, the carpal bones, which we just talked about where they are, and there's also a flexor retinaculum. So just think of it as a small structure. It really is not a very big structure, and we have the median nerve going through that area, along with a few tendons, quite a few tendons. So when those get inflamed from overuse, overextension, or just flexing, depending on what you're doing in your job or for a living or whatever you do on a daily basis, then that's when you start getting a little bit of pain. There could be some tingling sensations, all that kind of stuff happens, okay? So what is carpal tunnel syndrome, or CTS? It's a syndrome where there's an entrapment of the median nerve, and it brings about these signs and symptoms. The median nerve is actually within that carpal tunnel, and it controls, or you might get some numbing in the thumb, the forefinger, the middle finger, and about half of that ring finger. So if you were to kind of slice it in half right there. So this is all the region of that median nerve, what it controls, okay? And you'll get some of those sensations there, or some discomfort in those areas. If there's a little bit of inflammation or anything's wrong with those flexor tendons, which travel through that carpal tunnel area. Some signs and symptoms of carpal tunnel syndrome, or possible carpal tunnel syndrome, are tingling sensations. There's pins and needles. You could feel burning sensation. There could be numbness. There could be even weakness in those muscles of the hands. Treatment for this condition, once you're diagnosed with it, once your medical professional, your physical therapists, and other professionals are aware and certain that it is carpal tunnel syndrome, then you could have treatments anywhere from stretching that area to relieve that tension in those tendon regions or those tendinous regions. You could also have a wrist splint simultaneously while doing those exercises as well, and that will help keep that area nice and stacked, so it's not in too much flexion, for example, when you're sleeping, or overextended. So it helps keep it nice and stacked like that. There's also, if they deem that you need them, corticosteroid injections for the pain and to reduce that inflammation, as well as some of that connective tissue actually that's in there. It helps to dissolve that extra accumulation of connective tissue. And as I mentioned, exercises will probably be recommended during any of these kinds of treatments that they do, as well as if it's something that it becomes major and they need to do surgery, what they would do is just go in there and scrape that extra connective tissue that's accumulated in there. So those are some of the things that they may do or may recommend for you. What I'm going to go over is a few stretching exercises, and also how to determine, maybe with the test, it's not 100% certain, but how to determine if your carpal tunnel area is feeling a little angry at you for whatever reason. So we'll do that. So we'll go into the Phalen's test. There's a regular Phalen's test, and then there's the reversed one. We'll do the regular one, and it's spelled Phalen. So this one will determine if it is possible carpal tunnel syndrome. Don't freak out, but basically you'd hold your hands like this, and mine look a little wonky, honestly. Mine aren't perfectly straight, but you'd want to do this for about 30 seconds, bare minimum. Usually I've seen other practitioners recommend 60 seconds, and right now I've done about 15 seconds worth. If you feel tingling, numbness, burning, those symptoms that I told you about earlier, be on the lookout, see which fingers are feeling that sensation. If it's that thumb, that that index finger, the forefinger, the middle finger, and part of that ring finger, then it is possibly carpal tunnel syndrome. So you just want to hold that for about 60 seconds, and that's the Phalen's. And then you also have the reversed Phalen's, which is basically like this. And if you hold that, there's really, it could be 30 to 60 seconds, but for this one, if you do feel that numbness, that tingling sensation, the pins and needles, burning, any of those symptoms that were mentioned earlier, that means it's more pronounced, because this should be easier for you to do than this, right? So you just want to check that out. And I am elevating the trapezius, sorry guys. You don't want to do that. Just make sure your shoulders are comfortable, and then main thing is to make sure that your hands are nice and horizontal like that. All right, and then the last one is a compression test. This one's a little harder to do because you actually want to flex the hand or the wrist area at a 60-degree angle, which is not easy to determine. So that would probably be 45. So it's like a little bit more than 45. And then you want to go in that area and compress, and you want to see if there's pain or tingling or burning and all that stuff, that those symptoms that we mentioned earlier. And that's how you would verify if it's possibly carpal tunnel syndrome. However, if the pain does come from a different area, say it's actually from a neck injury, or you have neck tension and it's actually connected from there, or from the upper arm area, then you can't really think that it is carpal tunnel syndrome per se. Those tests are specifically targeting the wrist area, so it's more helpful than, say, something that targets a different area, like the shoulder. So those would be more specific for that area, and you could confirm if it does come from up here versus something that we just did for the wrists. start with a wrist extension, and you're going to make sure that you have your elbow fully extended, and then you'll have your fingers pointing down to the floor. You'll hold with the hand that will be stretching this one. Hold it, and you'll do about 2 seconds. 1, 1, 2, 2, about 10 sets. And that's active isolated stretching for the wrist area. All right, and then the next one is wrist flexion. So you're going to keep your elbow fully extended. Your palm will be down this time, and your fingers will be pointing to the floor, and then you'll just, you could hold it with your hand like this, but make sure that elbow is extended. And once again, you could do this for 10 sets, 2 seconds each time you do that stretch. Very gentle, don't get greedy. So 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, so on and so forth until you get 10. There's also finger stretches I'm going to show you in a little bit too, just so that you can learn some of those as well for your fingers. We'll be flexing the fingers 2 different ways first. So first, each and every finger, elbow doesn't matter at this point, okay? So you just wanna, that's 1, 1, 2, 2, 3, 3, 4, 5, so on and so forth until you hit 10. And then you'll go for the next finger, so on and so forth, make sure you do your thumb as well. Nice and gentle. And then we're gonna do the same flex, but we're gonna round those little fingers. So make sure they're in a little ball, and then you're going to flex. 3, 4, 4. That's like how I like to count until I hit 10. And then we're gonna do extensions of the fingers. So you want to support the whole finger, not just that tip. So you're actually going to go, 1 by 1, 1, 1, 2, 2, and these are extensions, not flexions. So flexions would be this way. Now you're going the opposite way. So that's extension, right? So you're going to do your whole, support that whole finger. 1, 1, 2, 2, 3, 3, 4, 4, and then so on and so forth until you hit 10, and then you'll do that for the next one. Make sure they always come back, to center where they need to go. You don't have to go all the way, but, just kind of let it be. And then, make sure you're supporting the whole finger. Okay? And that's it. I hope you guys enjoyed. And if you have any questions, just shoot them down below. I'll try to answer them as best as I can. Good luck and take care of yourself.